When considering a dentist or orthodontist for your child, don't you want the very latest in dental technology? That's what the doctors at Affiliated Pediatric Dentistry and Orthodontics can offer. As a matter of fact, you should take your little one in to see the dentist as early as 1 year old. Dr. Richard Chaet explains why. It's not often you see a monkey hanging around in a dental office. And Dr. Chaet, I know you are leading the way in helping kids not get cavities at an early age. Why is it so important that somebody sees a pediatric dentist?
Oh my goodness, Lisa. We've been trained to work with children. We went to school several more years, and we try to get prevention of disease, which is what a cavity is, at an early age. And the only time you can do this is getting a child in at around the year so we can sit down and discuss things with the parents.
Very important. And I know when people come here, it feels like call it a dental home, and it truly does feel that way here.
Oh my God, yes. We have a lot of fun. We have some slides for the kids to play with. We have video games. We have a tree house. We have all kinds of things for the children to do. And you know, you mentioned the term dental home. What we do with the dental home, it's all about having a safe and comfortable environment for the child.
Oh yeah.
If, for example, you're at home on a Saturday night and your little toddler's in the bathtub and he slips and falls, you need someplace to call.
Right.
And if you're not part of a practice, you're going to end up going to the emergency room, which is something that we really don't want you to do.
For something like a chipped tooth, you can come here.
You come here, or even on a Saturday, or we'll talk to the parent at night. Wow. So, you know, let me talk to you a little bit about, though, why the importance of this infant oral health exam is. We do a threefold program for the kids. First thing we'll do is sit down with the parent, just like you, and explain to them what causes a cavity, how to prevent the cavity, which is probably more important. And we talk about habits. Everyone has finger habits, thumb habits, pacifier habits, all kinds of little toys. And we talk again about injury prevention, so we do that. The second thing we do is you come to the office is we'll do an examination on your child, like left to left, like we're sitting, and then we'll show the parent how to brush your teeth. And then we go out, and of course then you've established your dental home in our practice.
Yeah, I remember all of that too. And what I love about this too is nowadays you don't think of, well, you get scared when you think about drills, but you have a way where you can fill a cavity without using a drill, right?
This is a very new product. It's called Icon, and yes, it actually works without drilling the teeth. We're using it now on our teenagers because all of a sudden when they go to high school, it seems like they're drinking more sport drinks and more soft drinks, because the parents kind of lose a little control of their little children who aren't so little anymore, and they're starting to get cavities in between the teeth. So it works there. It also works on children who may not have brushed their teeth very well with braces, and they have all the plaque and bacteria around the brackets. They take off the brackets, and lo and behold, you got some starting cavities. So this product works excellently right there.
Great information. You handle the little guys, and then when they get a little bit older, they need braces. So we're going to go talk with Dr. Bruce Goldstein about the orthodontic part of your children's teeth. Thanks, Dr. Chaet.
Thank you very much. Great talking to you.
Wow, that is one set of perfect-looking teeth, Dr. Goldstein, and I hear that you use something called SureSmile now to achieve that, right? Tell us about it.
SureSmile is an amazing technology. What we do is we actually use software that allows us to scan a patient after they have braces put on into a 3D image into the computer.
Okay.
We then have the ability to simulate our treatment, basically move teeth around to where we want them into an ideal position. And then we have a robot that actually bends the wires to move those teeth into that position.
Wow, it sounds so futuristic.
It is. It's been amazing.
Wow, and you said that will lower the amount of time that you have to wear braces?
Yeah, what we're finding is that we have improved our treatment quality. We have become much more efficient with our treatment. And we're treating patients about 40 to 50% faster than we ever did, which basically means if somebody was in treatment for 24 months, we're down to about 12 to 14 months. If they were supposed to be in treatment 18 months, we're down to about 9 to 10 months. So it's really opened up a lot of great things for patients.
Absolutely.
For instance, teenagers that were really worried about hygiene. And let's face it, it's very difficult to get teenagers to brush their teeth well. Well, we know that the longer they're wearing braces, the greater the chances of getting staining or decay. Okay. So by reducing the time in braces, we're seeing much less incidence of that. And what we're also finding is that more and more adults are following through with treatment now, especially a lot of the parents of our patients. They're coming in, seeing how much easier it is, how much less time they're wearing their braces, and they have come in and we're starting to treat them more and more. And, you know, for 24 months, they're not going to wear braces, but if they're going to do it in less than a year, they're very, very much...
they're more willing to try it and go
Exactly.
for it. That's great news. Thanks, Dr. Goldstein.
Thank you very much.
And Dr. Goldstein says the cost of that SureSmile is about the same as traditional braces. So if you want more information on affiliated pediatric dentistry and orthodontics, you can go to smilesbyapdo.com or call the number you see right there on your screen.